Had some pretty nasty symptoms. I was waking up 3 or 4 times a night. I couldn't breathe. Just a miserable way to go through life.
I came to Chicago ENT after trying a number of things to deal with chronic sinus infections and chronic allergies.
I was experiencing hearing loss for years. Not being able to hear was kind of dangerous. I almost got into several accidents because I couldn't hear the sirens.
I started practice 42 years ago, dreaming of creating a team that's the best of the best. Super experts combining research, teaching, and taking care of patients.
A typical patient who may come in with a chronic problem has probably already tried a lot of over-the-counter medications and seen the urgent care centers. When they come to Chicago ENT, they're looking for a more long-lasting solution.
We're here to listen to the patients and solve problems. And the way we do it is by teamwork. We have in Chicago ENT combined a group of experts in ear, nose, and throat problems, allergy problems, sleep problems, audiology, and we work together.
We have the ability as ENT doctors to really improve quality of life, whether it's breathing better, whether it's sleeping better, whether it's hearing better. I like being able to hone in on what's bothering the patient and provide a practical solution, and then to see that patient back and know that we've made an impact.
What I enjoy most about being an audiologist is having somebody come in with this complaint where they're having trouble hearing, getting them back into that world of hearing where they can enjoy life and communicate well with others.
Chicago ENT is an amazing organization. It's one of the few places where you have collaborative care. We can pool our resources and give the patient the best care they can possibly have.
We have specialists in several fields who can all work together with a patient to really tailor and individualize their care and provide them expert care and opinion in many different disciplines.
Our patients can come to see me, but then they can also see the allergists that we work with, our audiologists that we work with. If they need to, they can have diagnostic studies done right in our practice.
When I see a case that I find interesting or challenging, the first thing I do is bring it to my colleagues. It's that collaborative experience that gives me even more confidence going back to the patient with a particular recommendation, confident that we've come up with the best treatment plan for her condition.
We are also probably the most accessible ENT provider around.
We're very responsive. I think that's our goal, is to be available to people 24 hours a day.
Our policy is that we never say no. We're there when the patients need to be seen.
The Chicago ENT team was wonderful from the get-go. They were able to fit me in a timely manner that worked with my schedule.
The staff was incredibly responsive. They pick up right away and get you right to the right person, and they make sure that you're taken care of and you feel like you're actually not just a number as a patient.
I think of my patients as family members. Knowing the patient helps me help them.
Dr. Friedman is a really rare combination of an excellent physician and a really compassionate human being.
He came in the room after surgery and he looked at me and he said, "We got everything." And that was very touching to me. The way he looked at me, I knew that everything was going to be okay.
The most satisfaction I get is the dialogue with the patient. It's my job to figure out what their philosophy is towards medicine and health, curate their experience, and sort out what may work best for them.
We're all very compassionate providers here. We're not just telling people this is what they have to do. We're giving people options for different things to try.
The nature of sleep medicine requires that you really have a thorough understanding of the whole patient picture. So it's really important for me that I work very interactively and collaboratively with my patients towards the goal of getting them a good night's sleep.
The main thing I want to stress about Dr. Keneally is that she listened. It wasn't a matter of just nodding and agreeing. She engaged with me and really put my mind at ease in so many ways.
Dr. Friedman went above and beyond any normal standard of care that I've ever experienced with any physician, let alone an ENT.
The staff is wonderful. Everyone is kind. They get things done from the start to the finish. I know they're looking out for me. I can call in and immediately get a response.
They treat you not only like a patient, they treat you like a good friend. And if you have any questions, they will answer it.
I love feeling healthy. I don't think about it anymore, which is priceless to me.
I'd recommend Chicago ENT to my closest friends and family. I know that they're going to be in good hands.